Okay, so we're going to talk a little bit about low-dose naltrexone, okay? And specifically with thyroid disease, Hashimoto's. This was a CME lecture at one time. I got nothing to disclose. We'll just go through this. So where did it come from? 1985, the AIDS crisis. We were seeing all sorts of crazy infections and things, and we had. I remember we did something called use something called pentamidine, which is some sort of antiviral. We put it in a nebulizer because we were seeing all sorts of viral infections and parasites and all sorts of crazy. Nothing seemed to work all that well. Group of doctors, group of doctors in New York City, for whatever reason. So naltrexone had just been released in 1984. It'd been around for 20 years, but it was just released for general use as a for an opioid antagonist. And for whatever reason, I never have really figured out why they did it. I'm sure there's some reason. They took this stuff, it's usually 50 to 100 milligrams is the full dose, and they watered it down to 5 milligrams. And at 5 milligrams, it has anti-inflammatory and antioxidant and antiviral, antibiotic type effects. So that was the beginning of it. So it works on the opioid, so naltrexone works on the opioid receptors, and it works on interferon alpha and interferon beta. And immune cells are inhibited by morphine in dose-dependent manner, and endogenous opioid system is what's affected. So what you're left with at the end of the day is a sort of the body's tricked into producing endorphins by blocking the opioid receptors for a short period of time. So full dose naltrexone will last about 36-hour half-life, and the low dose naltrexone usually about 5 to 7 hours. While the opioids are being blocked, the body responds by making endorphins, which are sort of trapped until the naltrexone wears off, and then the endorphins flood the opioid receptors with this anti-inflammatory substance that we make. So there's something called opioid growth factors, which are pain modulators, and they regulate the immune system and the cell proliferation. Opioid growth factors and growth factor receptors are the sort of the immune complex that is formed. It decreases inflammation, particularly interferon gamma and TNF alpha. Naltrexone, like I said, so when it says permanently, that means usually more than 24 hours as long as you use the medication. It worked pretty well as far as for alcohol withdrawal. The problem with opioid withdrawal is that you still get all of the other effects of opioids, you just don't get high. And there were a lot of patients who were dying because, from the effects of opioids and other stuff they were using. So you get a blocking of the endorphin receptors, you get a blocking of the opioid growth factors and growth factor receptors. And low-dose naltrexone temporarily blocks the opioid growth factors. And then you get a rebound of endorphins. That's how it works, okay? Also, low-dose naltrexone attenuates the CNS microglia, and it attenuates TLR, toll receptor like 4 receptors also. So here's the difference between high-dose naltrexone and low-dose naltrexone. High-dose naltrexone blocks the opioid receptors continuously. It works on the metaenkephalin receptors. It decreases endorphins, and it promotes cell growth and increases tumor growth. And low-dose naltrexone has the exact opposite effect. Temporarily blocks opioid receptors, microglia is modifier, leads to an increase in endorphins, and inhibits toll-like receptor for mediated inflammatory cytokines, and it inhibits tumor growth factors. So low-dose naltrexone was felt to be 5 milligrams of naltrexone or less. Okay. This is, and so this was a CME thing. I wanted to put in here. Do you remember certs? You remember old enough to remember this certs, the TV commercials, and they'd knock the two. It was a mint, right? It was a
Oh,
breath mint and a candy mint. They did knock them together on a commercial. Let's say 2 mints in one. So low dose naltrexone is two medications in one, but it was CME credit, so I couldn't put the brand name in there. So on the left hand side over here is the levo, considered levo naltrexone, and that upregulates endorphin release, and it's an immune modulator. And on the right hand side, the dextro naltrexone, it modifies microglia in the brain and inhibits the pro-inflammatory cytokines. One of the reasons that it's so sort of universal in almost any kind of itis, especially autoimmune itis, is that it blocks, it reduces all of these cytokines, which is almost all of them. So that's one of the reasons you can use it for has such a wide range of efficacies. I did this. This was a paper I did. I actually presented this at the American Academy of Medical Acupuncture in 2015. And we found the paper and we did some experiments, and we found that medical acupuncture, for 25 minutes will reduce these cytokines here. So interleukins 1B, interleukins 2, 6, 12, 17, interferon gamma, and TNF alpha. And will upregulate the anti-inflammatory cytokines, interleukins 4 and 10. So if you compare it to low dose naltrexone, you can see you got a lot of the same. There's 10, there's 4, there's 1, there's 1B. So you're getting a lot of the same effects. I just thought that was kind of a neat thing. This was when I first wrote this. These were the 5 papers that I had written about, and so, as you know, we've done this before. Every time we look at some sort of malady issue, we look at what inflammatory cytokines are involved, and the common denominator is interleukin 6 and TGF beta 1. And if you remember when we did this psychiatric illnesses, which that's what I did last week at NOMA. The same one. So eight different type of psychiatric illnesses. Major depression, major anxiety, schizophrenia. Interleukin 6 and TGF beta 1 are also involved there. So these are some of the things that we talked about: hair loss, autism, TBI, post-finasteride syndrome, and then you can see that the low dose naltrexone will cover all of that. This is from there's a website, ldnresearchtrust.org. They have a lot of they run conferences on low dose naltrexone. This is just some of the issues that there's papers been written on, and there's a lot more. So you can see mast cell activation, autism, different types of cancers, fibromyalgia, mood disorders, weight loss. And then these are just skin diseases that sort of broken down even more. So these are the skin diseases that have studies done on them with low dose naltrexone. So you can see it's got a pretty broad, wide range. Psoriasis is sort of like a hallmark here. So psoriasis is a keratinocyte hyperproliferation, accelerates the turnover in skin cells from 27 days to 3 to 4 days. And it's associated, I don't know if you know this or not, associated with cardiovascular disease and cerebrovascular accidents. There's a 5-year shorter expected half-life due to cardiovascular disease with psoriasis.
wow.
Did you know that?
No, I did not know that.
But
no.
yeah, so that's the thing that we do. We put together. Connect the dots. So somebody comes in with psoriasis, you need to look at their heart, their cardiovascular system.
Yes, sir.
Okay, so this was a study done with low dose naltrexone. Here are the cytokines that are involved, and the genes that are involved with the psoriasis. And the epidermal opioid systems are are involved with especially the itching. And low dose naltrexone in this study, I think it was a decrease of 57%. Yeah, there we go. It's 57% decreased incidence, reduction of severe psoriasis. So these are the three, it should be 1, 2, 3. So it releases endorphins. We told you about that. It reduces pro-inflammatory cytokines and increases anti-inflammatory cytokines. The anti-inflammatory cytokines are interleukins 4 and 10, and it regulates that opioid growth factor receptor axis. That's pretty much how it works with pretty much everything. So if you can keep that in mind, that's kind of the mechanism of action. Okay. Got that? Here's some dosing and this is pretty standard dosing for low dose naltrexone. It's been shortened to 7 days. I used to do that this way at 14 days, but now I do 1.5 milligrams for 7 days, then 3 milligrams for 7 days, then 4.5 milligrams for 7 days. And interestingly, after 6 months, if you don't get a result that you want, decrease the dose and then bring it back up every 2 to 4 months to 4.5 milligrams. So I thought that was kind of interesting. So the way we write it is, so naltrexone will be in our EHR. I'll write it as naltrexone powder. And that'll come up, and then I'll write 1.5 milligrams. And you want to use the tablet, not the capsule. The side effects are much less with the tablet than the capsule. So you always want to write it as 1.5 milligram tablet times 7 days. Then 2 of them for 7 days, then 3 of them for 7 days. In the 3rd week, have the patient contact us for the next dose. If they're okay, if they don't have side effects, then you can make a 4.5 milligram tablet. And we like it at bedtime if they can tolerate it. I'll talk about the side effects in a minute. But 4.5 milligram tablet. So the loading dose, you need 42 pills for the first 3 weeks. And then after that, I usually write for 90 days. We get it from a couple of specialty pharmacies. We get it as low as I've gotten as low as 75 cents a pill, and they'll usually doesn't matter what the dose is, the ones we use, it's the same price for 1.5 milligrams as 4.5 milligrams.
Oh, that's great. That's good. Who do
Okay.
you use for that, Dr. Clearfield?
What's that?
Who do you use for your LDN?
We use Belmar in
Belmar.
Belmar, Belmar in Golden, Colorado.
Okay.
Okay, that's who we use. They give us the best price. Although my local guy called me the other day and said he'd give it to us for 79 cents, which is just 4 cents more, and the shipping would be less. So, it's $20 a month, really. It's really not that bad. So it's not a killer. It's not, you see these medications on advertised on football games. Did you ever see that? Ever look them up, how much they are? Here's plaque psoriasis. I'm doing great now. My skin's great after 6 months. I looked one of them up. I won't mention it since we're recording, but it begins with an S. You can look it up yourself. And it's on GoodRx, it's $19,000 a month.
Oh my gosh.
And then I think it's less now. It was a couple of years ago that again, during football, that's the only thing I ever watch is it was Harvoni, which for hepatitis C.
Yeah, that's right. Yeah.
And it was I think you have to use it for 3 months. And back then when I think it's less now, but it was $34,000 a month. So, I mean, it's ridiculous. So this is about $20 a month. So 25 at most. Lower dose with anxiety, depression. You can see that you start at 0.5 milligram, and everything that you see here, I have to revise this. Everything where it says 14 days to cut it down to 7 for the loading doses. So, and you see you get the top is 1 milligram AM and PM for that. So a little bit lower dose for anxiety and depression. You can make it into a topical solution. And so here, this is naltrexone. You can use this for eczema and psoriasis. So this is naltrexone and Benadryl and a little bit of vitamin D. A lot of times I will use this. I'll use this. So Zematop, is an anti I don't want to say it's the base, and it's non-allergic. It's a non-allergic base. Okay. And a lot of times I'll just use this because, if it doesn't work or whatnot, you don't know which is which. So I've used this a lot. We've used this for hair growth also.
Oh, really? Okay.
Yeah. You have to put it in a different base though, like something called tricosol. So that it gets, it'll soak into the scalp. But here's some here's some topical solutions. Hashimoto's thyroiditis, that's what we were talking about. It's immune T cell based thyroid tissue destruction. Graves' disease is hyperthyroidism, and it's induced by stimulatory autoantibodies. So what it is, here's Dr. Smith's. You like this? I added my own here. So remember, hers is gluten-free diet, fix the gut, and low dose naltrexone, right?
Right.
Right. Okay. So I added plant sterolins here. So the ones we like is Magicare. And it works great as an anti-inflammatory, and that's my first go-to. I use low dose naltrexone as a backup. That's my second line. So I do gluten-free diet, fix the gut, and the plant sterolins. Magicare is my go-to. If you can't find that, you can use Wobezyme N, which is an enzyme type of plant sterolin that's made by Douglas. They make lots of Wobezymes. You need the N. Okay, so but here you go. I got her here, right here, Dr. Smith, low dose naltrexone. So again, remember Dr. Halasa, TH1, TH2 balance. That's kind of what we're doing here. We're balancing it. The TH1 cells are responsible for intracellular parasites, excessive pro-inflammatory responses. You get a TH1 greater than TH2 imbalance. That's what happens. And then the low dose naltrexone will balance them. We'll put them back in order. Here are some cytokine issues with so it increased TH1, and this is Hashimoto's and Graves' disease, and also type 1 diabetes and multiple sclerosis. TH2, you get a decreased humoral response, increased autoantibodies, and then the TH17 is what'll happen with you'll get a rebalance with the low dose naltrexone here. Okay, so again, the mechanism of action, the same as I showed you before, increase 2 to 3-fold increase in endorphins, reduction of pro-inflammatory cytokines, increase in anti-inflammatory cytokines, and regulation of the opioid growth factor receptor axis. Low-dose naltrexone improves T4 to T3 conversion. Remember, I told you that you're going to get an improvement in thyroid function. You got to pay attention to your dosing if they're on thyroid medication, because after about 6 to 8 weeks, they're going to become hyperthyroid, and you usually have to reduce the dose. That's pretty common. I usually start at 1 milligram. You can start at a half if they're sensitive to it. Increase by 1 milligram every 7 days, a maximum of 3. This is for Hashimoto's thyroiditis and also multiple sclerosis. You lower doses than the sort of standard LDN dose. You can make it into a liquid and compound it. You can compound it into 0.1 milligram intervals. And again, this study here showed improvements in pain, energy, reduced fatigue, and improved mood. Okay, we use it a lot. This is a big help. This one's on Crohn's disease. And again, any type of itis. This was a study, they used the higher dose, 4.5 milligrams at bedtime. 67% of the patients had a remission of disease within 90 days. And this is an outfit called Cure Together. I think they got merged with somebody else. I think they're independent. But so Crohn's disease, they do surveys of different types of treatments, and they kind of put out this effectiveness versus popularity. And here are all here's the medications: Acecol, Pentasa. Here they're down here. Here's your low dose naltrexone up here. Effectiveness, and not all that popular because it's not all that well known. Okay, so steroids are over here, and here's your Humira here. So, okay, fibromyalgia, you know what that is. Everybody hurts and they don't know why. A lot of times this is turning out to be mold mycotoxin toxicity. Now I'm finding. I don't know if that's your experience.
Interesting.
Yeah. So your FDA approved drug is pregabalin, Lyrica, and patients either love it or hate it. They either do great and they feel great, or it makes them as sick as a dog, and they don't recover. And so here they got all these side effects, sleepiness, vertigo, they feel hungover. They tell me that they don't feel like their head's attached to their bodies. That's pretty common. Mood changes, loss of consciousness, bleeding, bruising, just the misogynosis. This study here, 12 women, average age 44, rheumatoid factors, if they had rheumatoid factors, ANA factors, or high SED rates, they were excluded. 50% of the patients were improved or much improved. I think this was over about 3 months. Objective findings were Ashi or tender point. So that Ashi point is that's what the acupuncturists call it, sore spot or trigger points. Hot and cold pain and SED rate elevation. Okay, this was a follow-up on the same crew, 22 after 22 weeks, 4.5 milligrams, and 28% pain relief. 33% response rate versus 11%, and improved quality of life and moods. So, not a cure, but an aid. Okay, improved NF-kappa beta, interleukin 6. And again, here's fibromyalgia. Here's that Cure Together, 104 fibromyalgia treatments. Here are your FDA-approved drugs down here. Here's Effexor. I think that's in there also. And then your low-dose naltrexone is far and away surprisingly effective. Multiple sclerosis. I've not had a whole lot of luck with this. I don't know, but if you've dealt with these folks at all. I guess the Walls protocol seems to be of some help, but that's hard to follow. I don't know if you've looked at that.
No, I'm not.
Yeah, it's really. It worked for her. And I actually met her. She was at she talked at A4M. I was talking to her in the exhibit hall with her and Felice Gersh. So, and she's functional. So, but it's difficult to follow. So, warning here: multiple sclerosis. The symptoms get worse for it before they get better. That's normal. And the mechanism of action is the same. Cancers. These are different types of cytokines that we see in different types of cancers. Again, same mechanisms of action. And cancer studies showed much improved tumor development and increased survival. So here's the treatment. Again, same treatment protocol: 1.5 milligrams for 7 nights, increased to 3 milligrams, 2 pills for a week, and then 3 pills for a week. Long-term for cancer, if it's under admission, you use it for a week, and then you do 3 days on, 3 days off. Low-dose naltrexone, will interfere with chemotherapy, and it will also interfere with opioids. So you can't use it with opioids. You have to be off of it for 2 days before and 2 days after chemotherapy. Sometimes, with opioids, you have an emergency, you break your arm and you need something for pain. It's kind of unavoidable. So autism, inability to sustain or initiate conversations, idiosyncratic language, failure to develop peer relationships. This is pretty classic picture. This is Wyatt. This is first day of kindergarten. You'll see all the kids here looking at the teacher, and Wyatt's looking away. Nobody he doesn't want to have anything to do with anything. Wyatt's now 16 years old and he's 6'4". The kid's a monster. So, he's son of a friend of mine. So, this is how I got started here. Are you still there?
Yeah, I'm right here, sir.
Okay. You look like you were frozen there. I made this little graphic here. It tells you exactly, this is sort of like the pathophysiology of autism. I made this myself. So you get microglial activation, especially in utero, inflammation, cytokine storm, maternal activation. So sometime of usually type of intrauterine infection, that kind of thing. These are the main symptoms that you get here: social isolation, hypersensitivity, language delay, repetitive behaviors. And again, low-dose naltrexone shifts the Th1 pro-inflammatory to the anti-inflammatory cytokines, and it downregulates interleukins 1-6 and TNF-alpha. Start at 1.1 milligram per kilogram. You can make it into a liquid. You can also make it into a cream. We've done that. Use it at bedtime. Again, you need a loading dose, and up to 3 milligrams for low-dose naltrexone in a cream. And you can just rub it on their arm or, leg or whatever. And so here are the side effects. So there's 3 of them. One is, so we usually dose it at bedtime. The idea is that, remember, the LDN is active for 6 to 8 hours or 5 to 7 hours. So if you take it at bedtime, by the time you wake up in the morning, you're loaded with your endorphins and ready to go. 10% of the patients, unfortunately, end up with a rebound insomnia. So according to the LDN Trust, you're supposed to back them down from bedtime to 2 hours before bedtime, and keep making it earlier and earlier until they don't get the insomnia. It gets to be a little bit tedious, so I usually just tell them the insomnia will happen in the first night or two. It's not like a big mystery. It's not going to, all of a sudden 6 months later show up. It'll either be there or not. If it is, I just usually tell them to take it in the daytime, and that's usually the end of that. And you don't have to arm wrestle with them. You can get some nausea. It usually goes away within a week or two. I'm using my ginger trick now for everything. So I about that, right? I told you about that.
Ginger trick?
Well, that's what we were using with the semaglutide and the terperazide. We have the patients get fresh ginger. I actually got called from the supermarket. There's a Safeway not even a mile from my office. I got a call from the manager one day, a couple of months ago. Said, "What the hell are you doing? Why are all these people coming in here? We can't keep ginger. We can't keep it in stock." I told him, I said, "You should thank me for it." I said, "I'm sending them up there to go get it." I said, "Right across the street is Save Mart." I said, "I'm not sending them there. I'm sending them to you. And you guys are more expensive."
And the pharmacist called you?
No, it was the store manager, the grocery manager at Safeway.
So funny, sir.
So fresh ginger. And we the stuff you get in the Japanese restaurant. We tell the patients to go get that and to chew on it when they're doing the semaglutide shot.
Yeah.
And if they get nausea from the low dose naltrexone, that usually goes away. But for the semaglutide shot, that's our secret sauce. Our discontinuation rate has gone down to almost nothing. We've had 4 patients in the last 6 months tell us they can't tolerate the semaglutide now, and we had to take the BPC out of it. We were still seeing 1 or 2 a week that were calling and saying they couldn't take it, and we almost have none now. And that's the key. And we tried ginger tea. That worked okay. Somebody tried ginger pills, capsules. That didn't work out so well. One guy tried ginger beer. I said, I don't know if that's going to work. Let me know how that one goes. So, but the fresh ginger works like a charm. And it's really great. So your semi-glutide patients, and we're getting 5 a day, every day. We don't even advertise it. And it's part of our protocol now. We tell them to go get that, and it works great.
We're seeing a trend of patients returning back to semaglutide versus tirzepatide because they get much better appetite suppression because the side effects are there.
Right.
So when they complain of ceiling effect with tirzepatide, put them back on semaglutide, and they get nauseous with eating too much. So,
well, you want to bring it close to home. Judy's been sick since before Christmas, and she's not felt well, and she's had stomach issues and GI issues and whatnot. And she went to the gastroenterologist and this and that. And she went to right, and then last week when I was away, I told you I was away last Friday. I was in South Lake.
yes.
One of my gals calls me and says, I've been giving Judy tirzepatide once a week for the last 3 months, right? And I said, no, she didn't know that at all. I said, well, and she's been using, so, sometimes we have to get, because we like to have the weekly shot in the office, we have to sometimes we don't get the ones with the B6 or the coated ones or whatnot. So she's been using one of the ones that are just sort of straight. I said, well, no wonder you've been sick. So she's been much better this week. Right? And she lives with me, So, you know what I said to her, right? You remember what Ann Audrey says? You dumb girl, you. So that's that. So those are the 3 side effects. Weight loss, they can actually make it into a pellet. 1.1 milligram and 1.1 gram and 2.2 gram pellets, and they'll last about 3 months. It's not a be all and end all, but it will decrease your appetite. It does improve thyroid function, as we know. It improves insulin resistance. It increases leptin levels, and it will it'll have it has an anti-inflammatory effect on weight gain. So fat mass is an inflammatory sort of reservoir itself. Improve sleep patterns. Then ultra low dose naltrexone, you can use this for as part of an opioid reduction plan. As an ultra low dose naltrexone is 2 micrograms, not milligrams, 2 micrograms, and it's sub-Q, and a day. Either sub-Q or I guess you can make it into a pill. We've done it sub-Q, we've done it shots, okay? And you decrease the opioids by 10% a week if they're short-term users, or 10% a month if they're long-term users. I've done this a couple of times. I haven't done this very often, but 2 micrograms a day. Here's some other topical solutions, one for alopecia areata, and topical wound care. Prevents keloid scarring. You can make it into a nose spray for sinusitis. You can actually add it into that BEG nose spray. There's those skin creams again. Wound care, scars. So naltrexone and aloe vera. Here's a nasal spray. You can make it into an eye drop. Different types of pain formulas. Like I said, I usually like it just plain. I just use the no low dose naltrexone 1% and just plain in Nimitop. This one has it with lidoderm, so topical lidocaine. This one has it with ketamine in it. gabapentin for neuropathic pain. You can make it into a liquid, into a sublingual drops, capsules, tablets, lotions, creams, and there is, like I said, there is a pellet for weight loss. Here's a basic dosing. So again, Hashimoto's half. I usually start at 1 milligram, half to 1 milligram. All others except for GYN cases, 1.5 milligrams. So pelvic pain, GYN, pelvic pain, endometriosis, fibroids, you need higher doses. So you need to start at 2.25 milligrams and go up to 9. Okay. So Hashimoto's and multiple sclerosis, the maximum of 3.0. Most everything else is 4.5.
Perfect.
Okay.
Sure.
Dosing tips, I already told you what to do with that. They said, they tell you to back down, but yeah, and right now I just tell them to take it during the daytime. Chronic fatigue, you need to dose it twice a day. So it's the same dose. It's 1.5 to this is what 4.5. But they split the dose. Kids start at a 0.5 milligram per kilogram. You go up, you can increase it every 7 days. You can make it into a liquid. Chronic pain and fertility, 1 milligram for 14 nights, and then increase it by 0.5 to 1 milligram up to 4.5. And here are the side effects that we talked about. So insomnia, 10%, vivid dreams. I didn't tell you about that one. So yeah, that's the third one, is nightmares. 23%, and then nausea, like a little bit. So I've had a couple people say they couldn't take it, it made them nauseous, and they stopped it. I've never had anybody stop it because they couldn't sleep, and some of the patients like the nightmares. So these side effects are really they come from the full dose naltrexone. So remember, we're talking 3.5, 4.5 milligrams. Here they're talking about liver and kidney toxicity at 300 milligrams. So contraindications, again, this is the full dose naltrexone. So hepatitis, liver failure, opioid. You need to be careful with opioids. That I usually stay away from them if they're on opioids. And organ transplant receptors. It'll interfere with anti-rejection drugs. So pros: increased sense of well-being, energy, self-confidence, muscle strength, increased sex drive. Cons: mood swings, mild joint disorders, sore joints, appetite loss, thinning hair, ulcers, difficulty sleeping. Again, most of this you see with the full dose naltrexone, and you have to remember why they're taking it. They're taking it because they're drug addicts or alcoholics. So a lot of that is they're already predisposed to that. I really don't see this. Would you see these cons here? At all? I mean, it's in the literature, so I have it here, but I've really not seen any of this. Appetite loss is usually somebody who's overweight anyway. Here are the cytokines again. So here's some other different maladies that we do. So, and you can see like the Hashimoto's works nicely there. Fibromyalgia, here's the acupuncture, anti-inflammatory pattern here, multiple sclerosis. So here's some natural remedies that will mimic low-dose naltrexone. So vitamin D, glutathione, so your antioxidants, anti-inflammatories, probiotics, butyrate, prebiotics, vitamin A, anti-inflammatories, curcumin, quercetin, bromelain. Skullcap is good for sleeping. And here's our references. And that's a sort of brief look at low-dose naltrexone.
Awesome. Dr. Clearfield, my wife is summoning me. She needs me to.
Yep, I know. I got to go too.
So that was an awesome lecture, and I'm really excited about going through these programs with you. I think it'll be really entertaining for you, and
Okay. I can't wait. I'll look at some of the ones that are already there when I get a chance. And like I said, this weekend I got to finish that lecture for the stem cell group, and because I was supposed to turn it in yesterday and I'm late. And when it starts, hang on. When it starts, we'll do it. Okay.
Awesome. Yes, sir.
Okay.